Today I'm going to show you how I decompress that lower back. And this is the called child pose. In the beginning, I mean, people laugh a lot. When I do this in my class, people think it's something like inappropriate. But this is the best way to decompress that lower back with those bands. So what I'm doing here, I get my clients at the end of the table. You can actually move a little bit forward. Okay. Because the camera, but you can do on the end of the table, whatever. So we're gonna do child pose. I'm explaining my clients what he's going to do. He's gonna go do child pose. If people never do child pose, he get the hands in front of him and go deeper in that, pull that butt back. This is the band. This is the 50 pounds band, and I'll show you how to use it. So I got to put this around hip. You see this around that hip. So want that pull that hip back. Now I'm step inside the band. Let me step inside. So you see I'm step inside. I can use one leg or I can use two legs and go around myself. Okay? So you see I am here. I'm not leaning back because if the band is going to rip off, you're going to fall off. So what I'm doing here, I'm asking my client to go in a child pose. Spread your knee. Spread your knee. So you see? And drop that butt down. Now watch what's the band doing. You see? I'm pulling that band. Like I said, I'm just stepping. I'm not leaning. You can lean a little bit. Make sure you're safe. The window is behind me and it's the second floor. If the band is going to snap and I'm not balancing, it's going to be not that good. So what I'm doing here, you see, I'm also not allowed him to move that hip. I can come up here and apply that pressure, butt this down. You see, I'm leaning. It's kind of forward.
It feels good.
It feels good, of course. It's decompressed. So you can also work on here. I can make it shorter. I can come up here, one hand, and move that butt down, you see. Also from here, I'm holding this lower back and sacrum. I'm always explaining, especially if this is female. Okay, I'm holding this butt. I'm not allowed to do moving that hip. I'm going to ask him to take that left arm and place right behind your back. No, behind your back, right in here. So you see, now I'm asking to turn his head up and try to look up. And I'm holding him. You see, try to look up. There we go, and down. So you feel that?
Yeah.
So, and it's not allow him to move. If I'm release that band, so go ahead, try to turn. You see, he can go far because he started moving that hip.
Right.
This band is decompress it and hold this in position, and also see how far he can go. Try to do opposite side. Switch. There we go. And you see and you can help. You can step to the side and you can help your client decompress and pull. If the band, yes. There we go. Always ask him to look. And you can decompress from the side. This is a great exercise. People say, can I use the sheets? Yes, you can use the sheet. The sheet have to be around you and you can kind of go around and hold those ends. So you're not going to fall.
Wow, it's very good.
It's very good, of course. This is what's the physio massage. This is what you rethinking. You can come up, release that band, and let me just. I usually step outside. Don't rush yourself. Don't get. You can go around that shoulder. Get this arm inside, around that shoulder. So this is the cross pattern now. So get it in child pose again. This one you can go around your shoulder, just like that. So you see, I'm in the shoulder, the microphone. So what I'm doing here, I'm holding this side and ask him again. Get this left hand in the back and start rotate it. So I'm pulling him up. Watch. I'm helping him.
Yeah, wow.
You helping you?
That's good.
You feel it, yes. So you see, I'm pull with him. And yes, of course I watch that hip too. Let me show you from the other side. So let's switch. Go around here.
I always try to compensate.
Yes, he always try to compensate. So you see it's around the shoulder. Here, like I said, whatever you feel comfortable. So make sure you're not going towards the face and not towards the client face. You see, it's around me. Look at that. So I can pull him so good. Down. So you see I'm holding it, and up, come up. Look at that. So I pull him, I can hold. Now I can apply the pressure, and he's going down on resistance now. So when he's going down, go up. So you see when he push down, he's activate his muscle. Here we go. So
Wow.
I pull more.
It's so good.
Now I release that and ask him to do without this band. Just do a couple times without
No,
band. And
it's
see
better. It's going to be better.
Look at that.
Wow.
Look at that. He been so stiff. So the bands is going to give you that feedback kick. And that's the idea of all this physio
Yeah.
massages and muscle activation. Soft tissue is great, but the band give you more result, more effect result. So don't ignore that. Do some soft tissue manipulation, fascia work, and of course bands with yourself. So you can apply this in your practice. As a massage therapist, I teach my client how to do this at home. I show them, and they do it, and they feel fantastic, much better.
Yeah, very good.
Thanks for watching, guys. Have a wonderful day.
Bye.